A nurse on the front lines in the fight against Ebola is now on the defensive.
At some point, there was a breach in protocol, and that breach in protocol resulted in this infection.
Early Sunday morning, a state lab in Austin would confirm the second Ebola diagnosis in the country's history. This time, a nurse infected while caring for the Liberian national Thomas Eric Duncan. Duncan tested positive for the virus late last month. He was isolated inside Dallas's Presbyterian Hospital and would die 11 days later, ultimately losing his life to a virus that devastated his native West Africa. His fight over, his nurses just beginning.
So when we got this phone call, which we thought we might get, we put in an action team in place, and they have been working all this evening. So as people are waking up, they know that they are safe.
Overnight, Hazmat crews dispatched to the nurse's M Street apartment. Another crew decontaminating the car she rode in, while a different team cleaned the hospital emergency room. A hazmat response coming 2 days after the nurse first drove herself to the hospital. Officials say 90 minutes after she walked in with a fever, she was quarantined.
Breaking the links in the chain of transmission is the key to preventing further spread. That's how we stopped it in Lagos, Nigeria. That's how we will stop it in Dallas.
Texas Health Presbyterian officials say the worker was one of 18 employees tracking their own symptoms. The female nurse reported a fever Friday night. Within 90 minutes, she had driven herself to the hospital and was placed in isolation.
The patient's condition is stable. A close contact has also been proactively placed in isolation.
The nurse had been caring for Thomas Duncan in the hospital's intensive care unit. Duncan died Wednesday morning from Ebola. Officials say she was considered low risk because she'd been in full protective gear each time she was in contact with Duncan.
We don't know what occurred in the care of the index patient, the original patient in Dallas, but at some point there was a breach in protocol, and that breach in protocol resulted in this infection.
That's why CDC Director Tom Frieden says he's launching a federal investigation. They're looking right now at the protective gear itself as the source of the safety breach, specifically how workers remove their own contaminated equipment. Investigators are also considering whether two high-risk procedures taken in desperation might have jeopardized those trying to save Thomas Duncan's life.
The two areas where we will be looking particularly closely is the performance of kidney dialysis and respiratory intubation. Both of those procedures may spread contaminated materials and are considered high-risk procedures.
Federal health officials worry now that other healthcare workers may have been exposed in the same safety breach. The CDC is now advising against those high-risk procedures, along with reducing the number of tests performed daily on an Ebola patient and limiting those responsible for care, so that patient number 2 doesn't place anyone else's life on the line. Janet St. James, Channel 8 News.
This is an important message from the city of Dallas.
Tonight, the second case of Ebola in Dallas.
Preliminary blood tests on a caregiver at Texas Health Presbyterian Hospital, Dallas, proved positive for Ebola.
Same hospital, this time a nurse who helped Dallas Ebola patient number 1.
There is much work to be done.
The latest on her condition, the medical response.
Saddens us to know that we have a second case. But I think we need to focus on right now getting the information out.
And easing the concerns of a nervous neighborhood.
We will stop it in Dallas.
Here in East Dallas, a hazmat team is at work at the apartment complex where the nurse lives, as another Dallas neighborhood worries about Ebola living right next door. The apartment complex is in East Dallas, a row of 8-plex apartment buildings.
It's a little creepy that it's just right down the street now.
Where neighbors got a knock on their doors at 5:30 in the morning, then saw a hazmat team outside.
It was really scary because we actually saw it before we talked to the police.
This is an important message from the city of Dallas.
And 2 hours later, a reverse 911 call was sent to all homes in a 4-block radius.
Please be advised that a healthcare worker who lives in your area has tested positive for the Ebola virus. While this may be concerning, there is no ongoing danger to your health.
Texas Health Presbyterian Hospital says the nurse is one of 18 employees who were tracking their own symptoms. She reported a fever Friday night and drove herself to the hospital and was placed in isolation. She was part of the team caring for Ebola patient Thomas Duncan in ICU. He died last Wednesday morning. And officials considered the nurse low risk because she was always in full protective gear.
We don't know what occurred in the care of the index patient, the original patient in Dallas, but at some point there was a breach in protocol, and that breach in protocol resulted in this infection.
That's why the CDC is looking at the protective gear itself as the possible source of the safety breach, specifically how workers remove the equipment. They're also considering whether two high-risk procedures taken in desperation might have jeopardized those trying to save Thomas Duncan's life.
The two areas where we will be looking particularly closely is the performance of kidney dialysis and respiratory intubation. Both of those procedures may spread contaminated materials and are considered high-risk procedures.
The apartment complex here in East Dallas is being disinfected by the same team that scoured the first Ebola victim's apartment. The SPCA is taking custody of the nurse's dog, and the watch for more possible cases here continues. In Dallas, I'm Kevin Reese. Now back to you.
The CDC director from Atlanta now clarifying an earlier statement saying that a breach in protocol does not necessarily mean that a mistake was made. This is something that is very scary to a lot of nurses that I spoke to this morning. The fact that one of their coworkers could have essentially done everything right, but yet they have a nurse who's infected with Ebola. The CDC right now saying they don't know exactly how it happened or when it happened. Earlier this morning, I spoke to a registered nurse who did not want to be identified. She says the mood inside the hospital has changed since the first positive Ebola diagnosis. She tells me patients are canceling appointments because they're scared, and she says she wants answers from her superiors and from the CDC.
What are the things that we need to do to be more careful? Do we need to invest in a more protective equipment? Does it need to be a little stronger than what we have now? Those are the questions that we actually kind of keep on the forefront.
That's a question that's very relevant. A team of 18 healthcare workers are being closely monitored by the CDC. More healthcare workers are currently caring for the nurse that is affected. The CDC saying there will double down on training for healthcare workers and increase care and education. This while a federal investigation tries to uncover what went wrong and pin down the moment of infection. As for the nurse in isolation, we're told by the CDC that she is clinically stable. In Dallas, Sebastian Robertson, Channel 8 News.
The second Ebola case in Dallas, currently in isolation at Texas Health Presbyterian Hospital, has caused a new level of anxiety here.
Decrease in appointments with our patients because our patients are very scared.
This nurse, who asked that we conceal her identity, says she is personally concerned for colleagues working to save the life of Nina Pham. The ICU nurse caught Ebola caring for Thomas Duncan in the days before he died.
What are the things that we need to do to be more careful? Do we need to invest in a more protective equipment? Does it need to be a little stronger than what we have now?
Federal officials now say that gear may actually need to be less complicated. CDC Director Tom Frieden says the nation's top infection control experts are now watching each time hospital staff put on and take off safety garb.
They're retraining staff in how to do that safely. They're looking at the types of personal protective equipment that are used to see if there are some types that may be easier to put on or take off and thereby reduce the risk that someone would unintentionally contaminate themselves.
Officials are also considering spraying down staff each time they exit the ICU with a chemical that kills Ebola. That protocol has worked in Africa, but is currently not being done in Dallas, according to the CDC director.
If you take a walk through the neighborhood that's home to the Dallas nurse who contracted Ebola, you'll find a lot of people like Bill Thayer walking their dogs and talking about saving the life of the nurse's pet.
If they can't, then it'll be very sad for the owner. Very sad situation.
Authorities believe that Nina Pham had very limited exposure to her King Charles Spaniel after she showed symptoms of Ebola. Nonetheless, they say the dog will be tested and quarantined in a location that, for security reasons, will remain undisclosed.
When I met with her parents, they said that dog's important to her, Judge. Don't let anything happen to the dog. If that dog has to be the boy in the plastic bubble, we're going to take good care of that dog.
Good old dog.
Down the street from Pham's apartment, Dave Bryson is taking care of a very sick rescue dog, and even he ponders a question, whether the nurse's dog should be euthanized.
I mean, I'm a dog lover, obviously, taking care of Max here, but there's also the flip side, which is if this is as deadly as it can be, do you want to destroy all traces of the disease?
See, that just scares me. I didn't even know she had a dog.
For the neighbors, it's just one more unsettling issue.
It just makes me scared to go to the grocery store or the gas station. I don't know. It's scary.
Authorities say Nina Pham has been very concerned about her dog. It seems she is not alone.
Men in full protective suits helped remove Nina Pham's dog Bentley from her apartment. Texas A&M veterinary experts are monitoring the dog.
There's great concern about how to protect this dog, how to treat this dog humanely while protecting the public.
There is concern from Pham's neighbors about whether the dog is contagious and what fluids and waste may have been left on the ground.
I know she's a responsible dog owner. She always picks up after her dog, but should something be left behind, I don't know if that's a way that my dog could contract Ebola.
The question of can dogs transfer Ebola to other dogs or humans is still up for debate. There just isn't enough research.
There is no evidence that a dog can transmit this disease to people by licking or by any other means. At this point, there is no evidence of that.
But a study conducted by a doctor in France and published by the CDC in 2005 says otherwise. They studied 439 dogs exposed to Ebola and found canine Ebola infection must be considered as a potential risk factor for human infection and virus spread. Human infection could occur through licking, biting, or grooming. Those caring for Bentley say he will not become a research animal to test any theory.
There are no plans to experiment on this dog. Our only plan is to take care of this person's pet.
A U.S. CDC expert told News 8 he doubts the French study and thinks it's unlikely Bentley is infected because Pham immediately quarantined herself and the dog had little exposure at the time she would have been contagious.
Everyone is working as hard as they can to keep you safe.
And with that, Dallas County commissioners had another update and intense conversation on local Ebola investigations.
We're dealing with uncharted territories that we're involved in.
As the county's health director, Zachary Thompson, announced he's now asking the CDC to review Dallas County's own biolab to help expedite testing on Ebola samples. Judge Clay Jenkins made a new call Tuesday morning for handling future Ebola patients.
All persons with a fever who have been to West Africa will be picked up and taken by Hazmat to Presby, not to Parkland, not anywhere else.
Jenkins admits uncertainty over Ebola has resulted in a large drop in people seeking other types of care from the same hospital that's treated Ebola victim Thomas Eric Duncan and now treating 26-year-old nurse Nina Pham.
I don't want to see that concern that is not founded in science visited upon Methodist or Parkland or one of our other hospitals.
And even with the two top infectious disease control doctors in the country and the most experienced doctor fighting Ebola in Africa now working with staff at Texas Health Presbyterian, some commissioners want assurances on procedures for emergency workers who may have to transport anyone showing signs or symptoms of Ebola.
I don't want Dallas County Health and Human Services Department being blamed for not putting a protocol that actually is not in our hands.
Jenkins says protocols are being discussed with emergency responders as the county continues updating its plan to handle Ebola virus.
Take a look at the latest tool in the fight against Ebola. It's a misting device, which when filled with the right chemicals, helps Hazmat cleanup crews decontaminate places like the apartment of Nina Pham, the young nurse who contracted the virus in Dallas. The product is the brainchild of a young Fort Worth company, eMist Innovations, which suddenly isn't so small anymore.
I got a shot of the New York Times where we're on the front page, the equipment there, and then all around the world there's been pictures of this equipment. So very surreal.
The process is simple. Up to a gallon of any water-soluble chemical is placed in the tank, and that is good for cleaning thousands of square feet.
When that particle leaves the machine, it attracts to everything in the room, the ceiling, floor, wraps around all of the devices or furniture in the room,
including potentially dangerous bacteria and viruses. So this is a wand?
Yeah.
Okay. The device itself is lightweight, movable, part of why crews utilized it earlier this week. Hospitals, cleaning companies, they are taking note.
So people have called and asked to go ahead and reserve over 1,000 units plus. And it's just, it is amazing where we're at today.
The company's manufacturer is actually in Arlington, too, meaning all of this is pieced together entirely in Tarrant County. Todd Unger, Channel 8 News.
Amber Vincent is now the third U.S. Ebola patient. She grew up in Akron, Ohio, attended Firestone High School. This is her high school picture. A family friend talked to News 8.
She's a wonderful young lady. She was very quiet as a girl growing up, but she was a sweetheart. That's all I remember her as, a sweetheart.
Vincent graduated from Kent State. 3 of her family members work there, including her mother. They are now being monitored for the next 21 days.
We're very concerned. It's scary. It's scary. I mean, and my heart goes out to all those people who've been in contact with this, you know.
Authorities say Vincent flew to Cleveland last weekend because she's engaged and was working on her wedding. She also visited family in Akron.
She flew into Cleveland to prepare for her wedding. She came in to visit her mother and her mother's fiancé.
She came back to Dallas on the 13th to her apartment here in Northeast Dallas. Her grandmother confirmed she was diagnosed with Ebola and told News 8 Vincent is a good girl and a fine young lady. She lived alone and did not have a pet, but authorities now in 2 states are tracing her moves.
They've been conducting a lot of interviews as far as her whereabouts, who was she in contact with.
Family members and friends say Vincent grew up attending church and wanted to get into a profession that helps people. That's why they say she became a nurse.
Up to now, the focus at Texas Health Presbyterian Hospital has rightly been on the Ebola patients. But as more cases have sprung up, there is the question, can the hospital itself recover?
I not worry about the hospital, being able to make it through this.
Healthcare vendor Rochelle Cohorn has been on the inside.
It feels like a ghost town. No one's even walking around the hospital.
Doctors confirm their patient loads at Presbyterian have fallen off dramatically as people cancel elective procedures. And the county judge acknowledges that people are avoiding the emergency room too.
We saw a large drop of people going to Presbyterian.
That is the stigma caused by Ebola and the system that allowed caregivers to become infected.
Clinical issues, especially infectious diseases like Ebola, are probably the worst reputational threat to a hospital.
Alex Normington works for a national firm that helps healthcare facilities grow their reputations.
A hospital's reputation could take years or even generations to build.
With names like Dealey and Perot adorning its various buildings, Texas Health Presbyterian has earned accolades in a slew of specialties as it has built a prestigious reputation all the way from opening day in 1966 until the last week of last month.
If you look at the reputation of this hospital prior to this Ebola event, it's been a very good one.
And Steve Love of the DFW Hospital Council believes that even with all the current challenges, the prognosis for Presbyterian is still good.
With 2 nurses now infected with Ebola, healthcare workers who came in direct contact with Duncan during his treatment seem to be at the most risk. The CDC says about 50 healthcare workers entered Duncan's room.
We're reviewing those and ensuring intensive follow-up of all of those individuals. We're also planning for other eventualities in case we get additional cases in the coming days.
More cases. At a press conference this morning, Dallas Mayor Mike Rawlings indicated that's something we should all be prepared for.
It may get worse before it gets better, but it will get better.
We've also learned that the newest Ebola patient, Amber Joy Vinson, flew from Cleveland to Dallas on Frontier Airlines Flight 1143, arriving here Monday at 6:31 p.m. There were 132 people on that plane who the CDC is now contacting but not monitoring. The CDC says the patient was not ill while flying and almost certainly not contagious.
Did not have a fever until the next day, did not have nausea or vomiting on the plane, or suggests to us that the risk to any around that individual on the plane would have been extremely low, but we are going and will always put in extra margins of safety.
Finally, there's the grouping of 48 people who Duncan came in contact with before he was admitted to Presbyterian. Those people are still being closely monitored, with 4 of them under quarantine. But as time has passed, officials say the likelihood of those people coming down with the virus is now very low.
Good news about those 48 people is they are asymptomatic and have no fever, and we are at the tail end of their monitoring period. Sunday will mark the end of that monitoring period, and the chance of those people becoming symptomatic at this point or getting the Ebola virus is extremely remote.
In the halls of power at the nation's capital lie plenty of questions.
I just got to ask the question, where was the disconnect here? Did the hospital not pay attention to what the CDC said, or did the CDC not give them the information?
Congressman Michael Burgess worked at Texas Health Presbyterian early in his medical career. Thursday, he is the vice chair of a congressional hearing, trying to pinpoint why mistakes are being made responding to Ebola in Dallas. The hospital's chief clinical officer will testify. So will CDC Director Tom Frieden, who admitted Tuesday that he should have sent a bigger team to Dallas initially.
Do you think Dr. Frieden should step down based on the CDC's response to this?
Look, there'll be plenty of time for after-action dissection of what's gone on. Right now, there's a crisis, and let's just get it fixed.
In August, Frieden told lawmakers that major hospitals would be ready to deal with Ebola. Still, Houston Democrat Gene Green told us by phone it's too early to tell who's at fault.
I don't know if you can blame him because somebody didn't, in a certain area, didn't follow the rules. I mean, he can't be at every hospital and facility in the country.
Perhaps. Protocols have been around since the 1970s. Had they been followed, the CDC insists, 2 nurses likely wouldn't have gotten Ebola. But is Frieden at fault or the hospital? Both are targets of criticism in a crisis with plenty to go around. In Washington, Jason Whiteley, Channel 8 News.
I truly believe in not living in fear.
It was an attentive and curious crowd.
Why did it seem like we were caught so off guard with this?
Community members sharing concerns, making comments, and asking questions about Ebola in Dallas before a panel of healthcare professionals.
Why have we not been given more information?
This gathering, a town hall meeting to address facts, not fear, over a virus that's already killed 1 man and now has 2 nurses who cared for him undergoing treatment.
The only way you can get it is by touching the wet secretions, the wet body fluids of a person who's actually sick with Ebola.
The panel of experts from Dallas County Medical Society and Texas Nurses Association initially addressed some of the community's common and recurring questions about how Ebola is spread. ABC's chief medical correspondent Richard Besser spoke to some of the frustrations with the flow of public information regarding the latest nurse who recently took a plane.
A lot of mixed messages coming out today. So the message that there's no risk from this, but then the message that the plane was decontaminated, I don't know how many times.
Many in this audience were healthcare workers who wanted to get to the bottom line about how the nurses contracted the virus.
There's 2 nurses that contracted Ebola. What happened and what is being done so this doesn't happen again?
Panel members say there is a lot of attention on the performance of the hospital right now, and procedure and protocols are questions the Texas Health and CDC are now asking. Damon Fernandez, Channel 8 News.
I'm told that man is feeling good. He's showing no signs of Ebola, but he will be off the job likely for the next 3 weeks out of precaution. That is what everyone who has come in contact with the 3 patients diagnosed with Ebola right here are being told to do. This latest case, though, is taking many by surprise over at Nation Star Mortgage in Louisville. The corporation got a call from one of its employees on Tuesday saying he was around Amber Vinson leading up to her diagnosis. Word started spreading yesterday. Senior staff held a conference call and were told to break the news to their employees in person and assure them they are 100% safe. Some wrote us at WFAA questioning why no additional cleaning crews were brought in. The senior VP of communication tells us the answer is simple.
Our understanding is from the health authorities we've talked to that since he was last at work on Thursday and the person he was in contact with who has the illness didn't show symptoms until this week, that there's no risk or danger to anyone at Nation Star because there was no contamination present in our building.
John Hoffman tells me he's been in close contact with the Dallas County Health and Human Services Department and are following their guidelines. And again, they say there is no danger to Nation Star employees. Now, that one contact was off from work on Friday. He was off again on Monday for the Columbus Day holiday. Remember, Amber Vinson only started showing signs of Ebola on Tuesday. Reporting outside Texas Health Presbyterian, Jenny Noren, Channel 8 News.
21, 23, 25.
The CDC director didn't respond to reporters as he entered. But inside the congressional hearing, with standing room only, Dr. Tom Frieden faced plenty of questions from lawmakers.
No, I'm talking about here in America.
You assured me that standard protocols were being followed.
Many members, mainly Republican, pushed for a travel ban from West Africa, something Frieden said could actually lead to infected people trying to sneak into this country.
We won't be able to check them for fever when they leave. We won't be able to check them for fever when they arrive.
Look, their reasons today are basically the same thing as saying that we should make sure that all children with chickenpox stay in school so we know who they are.
With Congress out of session, representatives returned to Washington to investigate mistakes made in Dallas while responding to Ebola.
I still don't feel like we have a good answer of why Nurse 1 and Nurse 2 contracted Ebola.
There never was a good answer. Perhaps the biggest revelation, though, came from the hospital. Texas Health Presbyterian admitted it received the CDC's health advisory on Ebola back in July. It posted the paper in the emergency room, but never trained anyone.
Now, was this information given to your emergency room personnel, and was there any actual person-to-person training at Texas Presbyterian for the staff at that time? Yes or no?
It was given to the emergency department.
Was there actual training?
No.
So who's at fault? 2 nurses have Ebola, dozens more from Texas Health are under observation, and neither the hospital nor the CDC could explain what went wrong. Outdated protocols or hospitals that don't take them seriously.
Let me wash the dishes.
Alice is cleaning up her North Dallas apartment. The certified nurse assistant should be caring for patients. She doesn't want us to use her full name.
I was surprised. I didn't know what to say because I was in shock. I didn't expect it.
Alice works as a CNA at Novus Health Services. According to its website, the Frisco healthcare company provides end-of-life care. Friday, she was seeing her last patient of the day when she received a phone call from the administration. They told her to go home.
I called again and I asked her, why should I go home? Can I be explained why I should go home? She told me, go home, don't let anybody go, and don't come to the office. Go home and I'll talk to you later.
The Kenyan native claims she was sent home after her employer learned her daughter had spent 2 days in Dallas last week. A rep for the company saying by phone it's all part of additional screening procedures, a move they say comes out of a, quote, abundance of caution. Shortly after being sent home, Alice was emailed this infectious disease contact tracking form, asking if she'd had any exposure to any person that had traveled abroad within the last 30 days.
Somebody like me being sent home to, from nowhere.
You're laughing. Why are you laughing?
Because it's funny to me.
Her native country of Kenya is more than 4,000 miles from some of the hardest hit areas in Africa. An abundance of caution that for today has Alice doing dishes, not seeing patients.
The Carnival magic was anchored in Belize when passenger Eric Lufer noticed a security boat pull alongside, and then the rumors began.
Some pretty crazy rumors. One of them was that people got shot on one of their excursions.
The rumors continued during a lengthy delay, and then the ship set sail for Cozumel. But Friday morning, the captain read this letter over the loudspeaker that a lab supervisor at Texas Health Presbyterian who did not have any direct contact with any infected patients was a passenger on board. That although they are symptom-free and not contagious, that they would keep the guest in isolation until they returned to Galveston on Sunday.
Never says what they're infected with, but clearly we knew what he was talking about.
Just concerned because there's so much of the unknown about Ebola.
Stephanie Macias' parents, Tony and Lupe from Cedar Hill, are on board the ship. She's not as upset with the cruise line as she is the passenger, now in quarantine.
It's very upsetting. I mean, if you've been exposed, you would think that you would know better than to go and take a trip. They have them in quarantine, but who's to say where that person was and where they're located in the vicinity to my parents.
The ship never docked in Cozumel. The Mexican government wouldn't let it.
So clearly, Mexico's like, we don't want any of this, so get away.
In a statement today, Carnival said, "We greatly regret that this situation, which was completely beyond our control, precluded the ship from making its scheduled visit to Cozumel." Meanwhile, passengers say life on the ship went on as normal except for the lingering questions whether Ebola or an Ebola overreaction has now reached far out to sea. Kevin Reese, Channel 8 News.
There's no crying. Happy tears are okay.
The Voice telling Nina Pham not to cry hours before the 26-year-old Ebola-stricken nurse was to be transferred to Maryland belongs to her doctor, Gary Weinstein.
I'm just a normal guy.
But the self-professed ordinary guy, a father and a fiancé, has lived an extraordinary, and some might say scary, 18 days. As chief of pulmonology and critical care at Texas Health Presbyterian Hospital, he helped guide treatment for all 3 Ebola patients, Amber Vinson, Nina Pham, and Thomas Duncan. People will be worried that I'm sitting here with you. What's your temperature?
Well, I have taken it 4 times today, and the most recent one was 97.2, and I have been afebrile.
I was not worried as we sat for an exclusive interview. By the time Dr. Weinstein became involved in the hospital's Ebola crisis, Thomas Duncan was on dialysis, intubated, and unconscious. The nation's best experts on Ebola had helped choose an experimental medication, but it did not work. Did you know he was dying? And that it was imminent?
It was very, very quick. He was critically ill and unstable, and over a period of minutes, he lost his pulse and was dead.
Many people have said that Thomas Duncan was not treated as well as he should have been because he was black and uninsured.
I find that remarkably insulting. I don't know how better to describe that. The team here worked their tails off to try and save his life.
Do you think you tried everything you could?
Yes.
Do you think he could not be saved?
Yes, he was too sick.
And then, 2 days later, Nurse Nina Pham showed up with a fever and what everyone hoped was a cold.
Just sunken. Felt horrible for her.
What was her reaction when she heard?
She was scared. She was scared. She risked her life, care for a patient, and now she was afraid for her life.
You couldn't even give her a hug.
Certainly not, certainly not like you'd want a hug. A hug through a couple layers of plastic is probably not as comforting as she needed.
Did you do that?
You bet I did.
Dr. Weinstein says the entire time he was involved with Nina Pham, Thomas Duncan, and Amber Vinson, everyone on the team was wearing hazmat gear from head to toe. They all believed they were fully protected. So how do you think it happened?
I think that These two nurses took care of a critically ill patient at a time when he was not in control of his body fluids, and at a time when the recommendations from the CDC that we were following did not include the full respiratory mask. I don't know that, but that's what one person thinks. That's me.
The CDC Friday night confirmed to News 8 that changes to the protective equipment required for Ebola treatment are imminent because of what was learned inside Texas Health Presbyterian. For now, Dr. Weinstein is worried about his hospital's reputation, his colleagues' damaged practices, and the people who voluntarily put their own lives on the lines.
These nurses, these therapists, they are truly heroes. This has not happened before, and they selflessly gave of themselves to care for these patients, and they shouldn't be shunned.
For a few hours there Saturday afternoon, some in Dallas worried we might have another Ebola case on our hands.
Train starts to pull up to the station. He doesn't stop. We see all the red lights. See a lady sitting on a bench in a hazmat mask.
The woman, hauled off to the hospital in head-to-toe protective gear as a precaution, did not have Ebola. Despite conflicting reports earlier in the day from officials, she might have been on the watch list. She wasn't.
This is a critical weekend.
Judge Clay Jenkins says that watch list could be cut by nearly a third Sunday night at midnight. If no new cases present, then the 48 original people who had contact with Thomas Eric Duncan will be in the clear, including his fiancée, Louise Tro.
Tomorrow afternoon, staff or someone will go by and review the family and take their temperature and make a determination that this is the end and they're clear.
A lack of new cases this weekend would also be important because of the wider implications.
We're going to be statistically unlikely or less likely to see more cases.
But when they end their quarantine, Duncan's family will not be returning to the scene of America's first Ebola case.
They weren't ever planning to go back to that apartment. Their lease was actually up on the 30th of that month, and they were planning to move somewhere else. Mayor Rawlings and I are personally invested in making sure that they have a nice place to live.
Despite today's events, Jenkins feels the Metroplex continues to remain calm and level-headed about the outbreak. Anita Coker, who was stuck at the DART station, says the panic may subside if or when Duncan's two nurses survive.
If they can get over it and we don't have any more outbreaks, then I think maybe it will slowly calm down.
For 21 days, members of the Wilshire Baptist Church were the go-between for a family and the world.
The show of love and compassion and support from the congregation has been tremendous in these past 3 weeks.
During that time, Louise Tro, her two nephews and son were shut off from their friends, neighbors, and other family members, quarantined in an undisclosed location because they shared a tiny apartment with Tro's fiancé, Thomas Eric Duncan. Tro is a member of this church. During Sunday service, she was mentioned by name. Pastor George Mason's sermon encouraged members to reach out to Tro and her family as they readjust to normal life.
Be with Louise Tro and her family as they grieve the loss of Eric.
Duncan became the first person in the U.S. to die of Ebola on October 8th. Pastor Mason says Tro and her family are anxious to return to normal, but worried about how they'll be received.
She is innocent and so are they. They've done nothing to bring this upon our community. They've had to suffer through this as well.
3 weeks later, and showing no symptoms, they're believed to be disease-free. But nearly everything they owned is gone. Personal items were destroyed by hazmat crews while decontaminating the building where they lived. They're starting over with little and while mourning a sudden and tremendous loss. But the family won't be returning to the Ivy Apartments. Instead, Mayor Rawlings says the city will help them find a new place to live. Carla Wade, Channel 8 News.
All signals point to a diminishing role for Presbyterian in the fight against Ebola. Dallas County Judge Clay Jenkins says the staff there is physically and emotionally exhausted and 75 workers are on the Ebola watch list. To pick up the load, he says Parkland Hospital will now stand up a GO team, 50 medical specialists who he says can assist at any local hospital. There are also plans to identify a new hospital as the primary Ebola facility, and that could happen as soon as tomorrow.
We think it would be best if we have more Ebola patients that we need to treat here in the Dallas area, that we do that somewhere else.
Nationally, the Pentagon is setting up its own GO team of nurses, doctors, and trainers, 30 in all, that can respond to domestic Ebola emergencies. The National Institutes of Health is supporting localized training across the country, but also trying to set reasonable expectations.
We need to pre-train people so that if we need to surge up, we can. But I think we don't want to get people to think that any hospital, community hospital, is totally equipped to care for the patient.
Back at Presbyterian, 75 healthcare workers enter another week of closely monitoring their temperatures for any signs of fever, a symptom of Ebola. Judge Jenkins said tonight 25 of them, mostly moms, are living at Presby to isolate themselves from their families. He calls them healthcare heroes.
You got 25 mostly moms up there who are going through the toughest moments in their lives, and they're doing it without their own children by their side.
There's no question today is a milestone day.
There are some signs we're now winning in the fight against Ebola after losing our nation's first patient diagnosed here.
It's a hurdle that we need to get over, but there are other hurdles to also jump.
43 of Thomas Eric Duncan's 48 contacts are out of isolation, virus-free. The rest are expected back in society any day now.
We are happy to have our kids back in our schools.
Dallas ISD is welcoming back 5 students and another 3 from Richardson ISD who are now transferring here.
This has been a situation that's hard to even conceive if you haven't lived it.
The senior pastor of Wilshire Baptist Church, where Duncan's fiance is a member, says we all have a choice in how we move on from Ebola.
There is some fraying at the fabric of our community because of this. And everyone in Dallas has a choice as to whether we're going to pull on those frayed threads or we're going to begin to knit them back together.
And as 2 young nurses continue their battle with this deadly virus, county leaders are asking all of us to be their cheerleaders. At the same time, they're admitting where they went wrong. Judge Clay Jenkins says Amber Vinson asked if it were okay for her to fly, but not all county leaders were part of the decision, letting her take off.
That was a mistake, and that caused her problems. It caused panic in our community. It caused people to miss school. It caused a lot of overreaction. It was a mistake, and we apologize.
County leaders say now is not the time to harp on what went wrong in the past, but focus on the future. A bit of good news, Dallas County is now running its own Ebola test rather than shipping the specimens to Austin. Only 12 states in the country are doing so. Reporting in Dallas, Jenny Doran, Channel 8 News.
The fact that Thomas Duncan's own family didn't get sick should speak volumes to a worried public, say health experts.
I hope that people can rest a little easier.
Health officials in part credit actions taken inside the apartment where Thomas Duncan was staying.
They not only did the cleaning of the apartment area, but they also did the cleaning of themselves.
Dallas County Health Director Zach Thompson is one of a handful of people who went inside that apartment before Hazmat. He says anything potentially contaminated by then had been wiped down or sealed off.
The left-hand side of the apartment was where Mr. Duncan was staying. They were very clear that everything related to Mr. Duncan was in that room. Everything had been stored, bagged, and was in that room.
Thompson says within hours of Duncan being admitted to Texas Health Presbyterian, the family had purchased cleaning supplies, including gloves and bleach, which kills Ebola. Even the carpet was sprayed down as a precaution. Thompson says those efforts may have kept the virus from spreading to the family and to the general public.
They looked out for themselves, therefore they looked out for others.
They are shots of the aftermath of a diagnosis, evidence of how Ebola ravages the body and home of those it infects. Pictures released by the Texas Commission on Environmental Quality show the process of treating the homes of 2 Dallas nurses battling the virus up close. They begin with crews in full hazmat outside Texas Health Presbyterian nurse Amber Vincent's apartment, which is shielded from view. Tarps cover the ground as teams dig through her belongings. In all, the commission says the crew filled 53 of these blue drums with keepsakes, bedding, and carpet that could have posed a risk. It's something the loved ones of Dallas's first Ebola patient, Thomas Duncan, know well. The apartment of his fiancée, Louise, was formally cleaned and the family quarantined. Early Monday, we learned they'd been in isolation in a retreat home belonging to the Catholic Diocese of Dallas.
Louise is still going through that time of loss and that time of pain.
Bishop Kevin Farrell spoke to Duncan's fiancée after her release.
I felt that there was a great sense of relief that this chapter is finally over. But at the same time, she has concern for the future.
He says she worries about how the community will receive her family now that they'll return to their very different home. Again, it's the TCEQ pictures that tell the story of what happens after cleanup. You're looking at pictures from inside nurse Nina Pham's apartment after decontamination, practically back to the way it was before she moved in. The fridge and cabinets are empty, and only a few big items remain. They are proof of her life before the virus, and another symbol of how Ebola has turned it upside down.
Today, new Ebola scares and added precautions. A man believed to be Liberian quarantined at a hospital in Newark, New Jersey after landing on a United Airlines flight with fever-like symptoms.
He is now asymptomatic. There is no indication at this point that he has been infected with the virus.
While in Chicago, 2 passengers traveling from Liberia, an adult and a child, hospitalized as a precaution after becoming sick on separate flights into O'Hare Airport.
This is exactly what we've been training for over the last several weeks.
Newark and O'Hare are among the 5 U.S. airports where there is enhanced Ebola screening. As of today, those 5 are the only airports where flights originating from Liberia, Sierra Leone, and Guinea are allowed to land. The Ebola outbreak in those West African countries has now claimed more than 4,500 lives. And today, an American journalist infected while in Liberia is finally going home. Ashoka Mukpo declared free of Ebola after weeks of treatment at this hospital in Nebraska, saying, "Too many are not as fortunate and lucky as I've been. I'm very happy to be alive." Meanwhile, the 2 nurses who were infected while treating an Ebola victim here in Dallas are still hospitalized but said to be doing well. Nurse Nina Pham's condition upgraded to good. In Dallas, Marcy Gonzalez, ABC News.
Federal health officials say monitoring travelers from Ebola-stricken countries for 21 days will help the world get ahead of the Ebola outbreak. Documents obtained by News 8 show the CDC has been a step behind. This email, labeled High Importance, was sent on behalf of CDC Director Tom Frieden September 27th, the day before Thomas Duncan was admitted to Texas Health Presbyterian Hospital. In it, he says the CDC will soon release the top 10 planning tips to help state and local health officials improve readiness.
Do you think that your response is coming too late?
In response to my question during a CDC conference call, Frieden admitted that travel rules that take effect Monday could have been a game changer had they been in place when Thomas Duncan arrived in the United States September 20th.
Which would have identified Mr. Duncan's symptoms earlier and would have, in all likelihood, resulted in that first emergency department visit not resulting in him being sent back home.
Frieden says he hopes now that travel rules and new guidelines for the protective gear healthcare workers must wear will stop Ebola from spreading.
Adonai, God in heaven.
Whoever would have thought a disease in West Africa would hit North Texas over and over and over again?
It's been really sobering and eye-opening.
What a faithful city we are.
Wednesday night, Fort Worth's religious communities gathered to pray for the well-being of those tormented by Ebola. Their timing was unintentionally spot on. 1 week after Dallas nurse Amber Vincent had been diagnosed with Ebola, we learned tonight the CDC declared her Ebola-free. This just-released photo of Vincent speaks volumes. She's smiling, taking a selfie from her hospital bed in Atlanta. Her mother issued a statement saying, "We all know that further treatment will be necessary as Amber continues to regain strength, but these latest developments have truly answered prayers and bring our family one step closer to reuniting with her at home." Vincent should soon be moved out of isolation. The second Dallas nurse fighting Ebola, Nina Pham, was upgraded Wednesday to good condition. The Nolan Catholic High School and TCU grad warmed hearts last week as she appeared in this video, upbeat, preparing to be transported from Presby to the National Institutes of Health in Bethesda, Maryland.
And we grieve for Nina Pham and Amber and their families as they've struggled through this, both of which are going to be fine.
Some back here at home believe Vincent's news bodes well for Pham too.
We believe there'll be more good news coming.
Hopes from home, they believe, have the power to help heal.
Well, we heard a lot this morning about lessons learned, about frustration, and also about how prepared Texas is to deal with another situation like this now, be it Ebola or another highly infectious disease. More than a dozen appointees on the Infectious Disease Task Force heard from a half dozen experts on the first panel this morning, and they're hearing from 3 panels today. They heard from the medical director at Parkland and UT Southwestern, also a doctor who dealt with Ebola in Africa decades ago. We heard frustration from hospital directors who said they still cannot get the right protective gear for their staff. Doctors seem to agree that we need more than 2 Ebola specialty centers being opened now, Richardson and Galveston. They urge specialized training for small groups of volunteers in hospitals across Texas. And we also heard a lot about the damaging effects of too much bad information.
It's a huge problem. I think that the overblown fear of this has been probably the most difficult to manage. And what happens with that is, and we talked about this in the panel, what happens is that you see resources being pulled away from where they should be because we're trying to deal with really unfounded fears of people wanting to close schools.
Dr. Joseph McCormick said he's much more concerned about a flu outbreak than more Ebola. Dr. David Lakey with the State Health Department opened up the session by thanking healthcare workers who handled the Ebola cases in Dallas. The goal of all this is to boil down suggestions and put them into legislation next year because they said the nation is looking at how Texas handles this. At the Capitol in Austin, Jim Douglas, Channel 8 News.
So what we're doing with these? Mark Luke is a world away from the epicenter of the Ebola outbreak, but the pain of the virus has followed him. Ebola is very, very terrible. Very terrible. A healthcare worker in his native Liberia, Luke lost co-workers, friends, and just last month, his cousin to the deadly virus. We were like brothers and sisters, very close, but she died from Ebola too. So that was very horrifying. I lost about 2-3 days in school. I couldn't just get to myself. Luke came to the United States 3 months ago. He's working towards a certificate in biochemical engineering through Medicen's Global Education Center. When news broke that Ebola hit Dallas, it sickened him. That was the news I didn't want to hear. So I felt sick in the stomach, and I didn't have appetite to eat for some time. Thursday, he isn't alone as he tries to help his native West Africa. Standing alongside former and current Olympians, dozens of volunteers are packing much-needed medical supplies.
It's actually very positive. It's been the response that we've had so far, and that people really want to help. And they're beginning to understand that even $1 can make a difference.
Thursday, the World Olympians Association, teaming up with Medicine, packing and labeling boxes that will fill 40-foot shipping containers bound for Sierra Leone. So many times I feel bad that I'm on the side and people back home are dying. While he mourns the ones he's lost, he's working to make sure others won't have to do the same.
A suburban townhouse dressed in the visual language of Ebola. Red hazmat bags, yellow caution tape. Is it bad taste or good fun? Maybe a bit of both. But then again, James Falk doesn't really care what you think.
There's going to be naysayers, there's going to be people that hate it, and there already are. But in the end, everything with Ebola has turned out good in Dallas, thankfully, except for Mr. Thomas.
Oh yeah, that little detail, the death of Thomas Eric Duncan, the first Ebola patient.
The first morning when I drove by and saw it, it kind of gave me a pause.
Falk says the display went up on Sunday night. By Monday morning, the University Park Police stopped by to check it out. But the city says he's not breaking the law, just cracking a joke. It's up to you to decide if it's actually funny.
What constitutes
the line between funny and not funny?
I think it gets thinner and thinner these days. It never seems to amaze me on what will offend people these days, and I'm sure I'm crossing the line.
Usually, crossing the line is a recipe for a punchline. Late-night comedians are poking fun at politicians and the CDC for their handling of Ebola, so why not James Falk?
Is this just about being funny, or are you actually saying something here?
I mean, obviously now I have a podium to some extent, so I don't want to slam our officials, our elected officials, too much. But let's face it, they dropped the ball on a lot of areas, and they didn't take it as seriously as they should have.
And I tell you, the rest of the nation is looking at what we're doing here in Texas, what our lessons have learned.
The task force heard from 15 experts. They want more intensive training for more hospital workers. Some said they still could not get enough personal protection equipment of the best kind for their staff.
And what they said was they had everything except they couldn't get the face mask yet because they were backordered.
Dr. Joseph McCormick treated Ebola patients in Africa decades ago. He challenged the creation of only 2 Ebola treatment centers in Texas, in Richardson and Galveston.
I'm not arguing that you shouldn't have these centers, but I am arguing that we can't choose where these patients are going to be.
You know, the national strategy was that community hospitals would be able to care for individuals, and I think our experience here shows that that strategy needs to change.
Health Commissioner Dr. David Lakey said Texas might open more regional centers. The director of the task force on infectious disease said that a top concern is the legal authority to enforce strict quarantines.
If you're going to issue that order, you should have the enforceability to do that, because we don't want the first time they break it to be a potential spread to the entire community.
The task force did not call any experts from Presbyterian Hospital, the only one in Texas with direct first-hand experience with Ebola.
So we are being greatly informed by Presbyterian, but again, this panel I think should be above the fray to be able to look at all the experiences, to summarize them, and to put them into recommendations.
Dr. Brett Giroff says they'll make recommendations to Texas lawmakers by December 1st. Dr. McCormick says one of them should be better managing the spread of fear.
It's a huge problem. I think that the overblown fear of this has been probably the most difficult to manage.
In Austin, Jim Douglas, Channel 8 News.
He's a doctor.
Frustration is apparent as 2 states scramble to contain the Ebola virus. News 8 Learning Casey Hickcock, a UTA alum, now nurse, working with Doctors Without Borders, is among the first under a mandatory quarantine at a New Jersey hospital. A rep for Doctors Without Borders saying Hickcock was detained upon her arrival from Sierra Leone, initially recording no fever, but several hours after being detained, she was tested again. Her fever slightly elevated. 3 hours later, they say she was taken to Newark University Hospital by staff in full hazmat and a police escort. In a written statement, a rep for Doctors Without Borders urging policymakers to draft fair and reasonable guidelines, saying, quote, "There is a notable lack of clarity about the new guidelines announced yesterday by state authorities in New York and New Jersey." She continues to say it's not clear how long Hickcock could remain in isolation, saying the nurse is being held in a tent dressed in paper scrubs. This while a very different Ebola storyline is playing out in Texas. Overnight in Fort Worth, nurse Nina Pham reunited with family. Hours earlier, a bear hug from the president.
She was bouncing around, talking to her friends, taking a lot of pictures of people, and just really, really happy to be home.
Pham's battle with Ebola nearing its end, while the rest of the country braces for the possibility of more cases. Dallas County Judge Clay Jenkins has faith his city, once the epicenter, now has the upper hand.
Are you confident that Dallas has contained Ebola?
I believe we're winning the fight against Ebola. It's not over yet. We have to stay meticulous and focused.
In Dallas, Sebastian Robertson, Channel 8 News.